Sedation. I mean, you do IV sedation at your...
Yes, majority of our patients are sedated, and that makes it much more comfortable for them. And they can then, one of the best things about sedation is that they don't remember anything of the procedure.
Is that right?
So they go to sleep, they wake up, everything is done. Majority of patients who we sedate, what we hear is that the last thing I remember is you starting the IV line, and I don't remember anything else. And they wake up, they go home, it's not a painful procedure, they have some swelling, they're going to be in a little bit softer diet, what I call a semi-soft diet, for a week or so, but they can go to work, to school the next day. All I ask them is not to work out for about 3-4 days, and that's usually not a problem for the majority of patients.
And you have dentists that go to you. When they want their gums looking good, the word is on the street, right?
Yes.
I'm kidding around, but I mean, you see a lot of dentists.
Yes, absolutely.
Kind of
just because of the nature of my practice of lecturing and teaching a lot of the cosmetic procedures, we have developed a reputation for being the practice for cosmetic procedures when it comes to implants.
In your lingo, they call it aesthetic gum surgery?
Yes. In our lingo, as you call it, we call it aesthetic periodontal therapy or aesthetic gum surgery and aesthetic dental implant therapy. And so, yes, we get a lot of dentists that come themselves to me for treatment.
Do they want to be sedated, by the way?
Well,
I always wonder about this.
Yes, that's an interesting question. The majority of dentists that we have treated, because they know what's going to happen, they think, no, I don't need to be sedated, because they think, well, I know exactly what's going to happen, and I'm used to getting local anesthesia and giving local anesthesia, obviously, so they do not want to be sedated. But I'll tell you, almost 98% of these dentists that we treat, at the end of the procedure, they say, I wish I was sedated. And so nowadays when we treat dentists, we tell them this story, and most of them do choose to be sedated.
Seems like an easier way to go. But there's a lot of people with their fear of the dentist keeps them from having the smile they've always wanted.
Yes, and not only does it help those patients who have got a fear of the dentist going in and getting these procedures done, but it's actually medically safer when you're sedated, because when you're sedated, all your vital signs, everything is being monitored, and you're calmer. So for example, in patients who have had heart attacks in the past, or patients who are overweight or have high blood pressure issues, in conjunction with their physicians,
sedation is safer.
Much safer, because it's a much more stable procedure once you're doing it with intravenous sedation.